Hello. Today we are going to talk about teaching. Teaching scenarios are one of the most important topics in PLAB 2 because you can find two scenarios of teaching in your exam. So it's very important to study teaching scenarios very well. You need to master them. And teaching is one of the easiest chapters because you know some information about something and you need to teach it to another one, okay? And they are looking for like teaching skills. Are you able to teach others? Do you have the skill to teach others? And so on. So what we'll discuss today is teaching scenarios and teaching approach, and then we will discuss each scenario in details, okay? Let's start by teaching stations. You can teach a colleague and also you can teach a patient. And it will differ from teaching the patient and teaching a colleague. In teaching the patient, you need to gather some information about the patient and what kind of symptoms that he had, and to collect some information. It's kind of data gathering, like medicine stations. But if you are talking to a colleague, you need to just to build rapport and show that your teaching skills in friendly way. And it will be quite different from teaching patient to teaching colleague, okay? We have one station of teaching patient, which is EpiPen. And the others, you will teach a nurse, you will teach a student, you will teach an FY1, and so on. Let's talk about the approach. When you are going to teach a patient, you need to confirm the patient identity. Okay, could you confirm your name, your age? If he is a relative, could you confirm how are you related to blah, blah, blah. And then you gather some information about what happened. Like in EpiPen, for example, what kind of symptoms that your daughter had, what kind of investigation done to her, what kind of treatment given to her, what you've been told so far about her condition. We call it 4 questions. It's kind of collecting information questions when you are seeing a patient for the second time, or if the patient is admitted with you and going to be discharged. You will ask 4 questions: what kind of symptoms, what kind of investigation, what kind of treatment given to her, and what you've been told about her condition so far. And apart from this, any medical condition, any medication, any other allergies, and like you can ask about hobbies, you can ask about diet, exercise, and if old patient, you can ask about smoking and alcohol. So it's like a medicine station. You need to gather information, but do it quickly, as fast as you can. And then you will teach the patient or the relative how to take the EpiPen. And we will discuss this in the EpiPen scenario. But if you are going to talk to your colleague, you need to introduce yourself. Hello, I'm Basant, I'm one of FY2 here. And you can say FY2 here because he's a colleague and he understands what's FY2. And you can say it in a friendly way. Hi Liam, hi Lena, like hi, and as you are friends, or you are colleague and you know each other. Then you need to build rapport. And teaching a scenario is not long stations, so take your time to build rapport, like how is your shift today, and how is your rotation, and any exams are coming, do you need any help? And then paraphrase. Say what you should do. I understand that you want to learn about basic life support. I understand that you want to learn about like EpiPen, like ECG, and so on. Paraphrase your task. And then before teaching anyone about something, you need to know his knowledge. So what do you know and what do you want to know about this? So he might, like in ECG, he know how to do ECG, but he needs to know how to read ECG, how to understand these waves in ECG. Then, as you can see here, there are 4 W questions, like what do you know, what do you want to know, and why we need this, and what is this in the first place. So what do you know, what do you want to know, what is the thing you are going to teach the patient, the colleague about, and the last thing, why and when we need it. If there is contraindication for this procedure or this maneuver, tell the patient about and tell your colleague about. If there are steps, you need to say it in layers, say it in a clear way. And the most important thing in teaching is how to deliver the information. You can change your tone. You also need to force on some things. Make the conversation interactive. Don't talk too much, please. Every now and then, with a colleague, you need to say, are you following me? Are we on the same page? If I'm going fast, please stop me. These kind of skills, interpersonal skills, are very important in teaching scenarios. Okay. There is mnemonics called PLAB. If you are going to do a specific maneuver to a patient, you need to explore and tell the patient about this procedure by telling him about PLAB: procedure, position, exposure, taperum, and consent. How to say it to the patient? Well, at the moment, I'd like to do, for example, abdominal examination. So this is the procedure. Then, position. I'd like you to lie on your back and to expose. This is the position. And exposure, to expose from above to your waist, for example. And maintain your privacy. I'll have a chaperone with me. Is that okay? This is the way to tell the patient that you are going to do a specific procedure. And you can tell your colleague about this mnemonic or these steps you should that you should tell the patient about. For example, if you are going to do abdominal examination, you need to tell your colleague that you need to go to the patient, explore the procedure, the position, what he should expose, and maintain privacy, have a chaperone, and also take consent from the patient. This is the way you explain to your colleague how to take consent and how to explore something to the patient. Okay? And then remember, you need to have these teaching skills. For example, you are going to tell the patient about basic life support. Basic life support starts by, for example, make sure that the patient is safe and you are safe. You can say it, make sure the patient is safe and you will be safe. And you can say it in another way. Do you know what is the most important thing before doing basic life support? Is to make sure that you will be safe and your patient is safe, to be able to help him. So this is the way or the skills they need to see from you in the exam. That you are encouraging others to learn, that you have good communication skills, you have teaching skills. You can please don't talk too much. Stop and check. Am I going fast? Do you want me to repeat something for you? Are we on the same page? You can say is that clear? Are you following me? And so on. It changes the words you're gonna say, are you following me? And then you can say, is that clear? Do you want me to repeat something to you? Okay? Let's recap in details. We will go hello, hello Liam, hello is the name of your colleague. I'm Basant, I'm 1FFY2 in the emergency department in the acute medical unit. Have we met before? And then build rapport. How is your shift? How is your rotation? Any exams coming? Do you need any help in your exams? Then I understand that you want to learn about something. Then assess knowledge. What do you know about this thing? What do you want to know? Do you know what is this procedure, this technique, and so on, and why and when we do it. Before teaching, please gather information, prepare your checklist, and during this, choose each step by step. And after this, address if there is any question, any concerns. And after this, make sure that the patient have clear information, and has the patient, your colleague can understand well the information and can tell you back, okay, could you recap what we have discussed today? Could you show me how to do it? Do you want me to repeat something? And you need to encourage him to come back to you if you want to learn about something. So introduce yourself, confirm that we have met before and build rapport, then ask the questions about knowledge. What do you know? What do you want to know? Start to teach. If you are collecting some information, collect information. If you want to prepare your equipment, prepare equipment, and then do the step by step, and then let the colleague explain that again to you, and then encourage him to come again if he has any question. Don't hesitate to ask. Then we will talk about each station in details, how to tackle this station, what is the most important thing you need to remember in the next video.